Paresh Chandra Paul.
মই অজিত কুমাৰ পাল, তেখেত মোৰ দেউতা। আমি আহিছোঁ বৰপৰোডৰ পৰা। হঠাৎ এদিন মানে আবেলি সন্ধিয়াত পৰি গ'ল। তাৰপিছত আমি বৰপৰোড হস্পিটেলত দেখোঁ, তাৰ পৰা ক'লে যে গুৱাহাটী শ্বিফ্ট কৰক। আমি ওচৰতে পালোঁ নাৰায়ণে, তাতে ভৰ্তি হ'লোঁ। টেম্পৰাৰী পেচমেকাৰ লগালে, তাৰপিছত ক'লে যে পাৰ্মানেণ্টটো লগালোঁ। অবজাৰ্ভেশ্যন কৰাৰ পিছত পাৰ্মানেণ্টটো লগালে, এতিয়া ভাল পাইছে।
I am Dr. Ritankur Barkotoky. I am the senior cardiologist here in Narayana Superspeciality Hospital, Guwahati. So today we would like to discuss about the interesting case which we recently operated upon. He is Mr. Paul. His age is 96 years of age. He presented to our emergency department in an unconscious state. There was a history of fall at home, and after that patient became unconscious. Patient was taken to our emergency department, and when we received the patient in the emergency department, his pulse rate was around 30-35 per minute, and patient, because of this low heart rate or pulse rate, patient had a fall, and that ultimately injured his head. So when we saw the patient in the emergency, we could understand that patient is actually suffering from complete heart block. That is a diagnosis where the pulse drops suddenly to a critically significant level of around 30-35, where the patient is unable to maintain his conscious level. The patient suddenly becomes unconscious, or suddenly they can fall also. So in that situation, immediately we have to implant a temporary pacemaker, and then we have stabilized the patient in our ICU. So we have a multi-team approach in our hospital. We have a very good critical care team in the ICU. We have got very good cardiac anesthesia as well as cardiology and cardiac surgery team for backup. So we could tackle that patient very well. Initial stabilization was done for initial 2 days. After that, we have decided that ultimately the patient needs a permanent pacemaker implantation. So considering the age, the patient's attendants were a little apprehensive initially that at 96, can a person undergo any major surgery like pacemaker implantation? But we have assured them that it is not the age. I think because the requirement is absolute, there is no alternative now available, because the patient is dependent on pacemaker. Now there is no alternative, so we have to go ahead, and we have assured them that we have got a very good team approach in cardiology, cardiac surgery, cardiac anesthesia, so we can handle that case. So we have decided to operate upon that case, and we have successfully operated him around 3 days back within half an hour to 40 minutes time. The cardiac anesthesia backup was good during that time, and we could immediately after the operation, we could immediately stabilize the patient, and the patient remained conscious during the post-operative phase, and now within 3 days we are planning to discharge the patient. He is absolutely conscious, fine, he is able to walk now. So the message I want to give from the experience of this patient is that the age is not just a factor in deciding whether we want to go for surgery or not. It is the requirement of the patient. Sometimes the patient requires surgery, there is no alternative available. So irrespective of the age, if there is no alternative available, I think the only surgery can prolong his life. And if we want to really prolong or help the patient, I think the surgery even at the age of 96 is safe, because here at the age of 96, even he had so much of comorbidities in the form of kidney disease, in the form of extensive lung disease. Still, with the modern techniques and good backup, we could successfully do the surgery within 30 to 35 minutes time. So the message I want to convey to all of you regarding this case is that many times we see that patient comes to us and they are having frequent symptoms. They may need a pacemaker, or sometimes they need a angiography or angioplasty to relieve their symptoms. But many times we hesitate that age is 75, so why should the person undergo a surgery? And even if we sometimes we advise surgery and becomes patient's attendant, or sometimes there is a apprehension among them that why surgery needs to be done. But it is not the age, it is the requirement. Sometimes there is an absolute requirement for surgery. In that case, there is no alternative available. So I think you can very safely undergo surgery in a tertiary care center like us, where there are good backup system available 24/7 in ICU as well as in the OT, and the post-operative care is excellent. So with this, I think I would like to conclude my talk. And I wish our patient very good, healthy, and prosperous life ahead. And I thank him, for deciding or putting his faith on us to get operated at this age also. and I wish him all the best. Thank you.